Hi, I'm Dr. Rich Bowler, President and CEO of St. Joseph Hospital in Nashua. Year in and year out, there are continuous needs in terms of access to care, in terms of getting access to dental services, behavioral health services, and nutrition and obesity. We are partnering with the City of Nashua, with the Public Health Department, to bring a mobile dental and medical van to the City of Nashua and its 11 surrounding communities. This van will be able to get out into the communities and reach individuals who, for lots of reasons, may not have access to care. Our goal is to bring services on site so that the patients will have the opportunity to partake of them. So in addition to the acute care medical side, we're going to have dental services. I'm really excited about this because we can start school-based programs. I think the most important thing that we can do is provide for early intervention and prevention. Another feature that's going to be outstanding is we're going to have a LADAC, a licensed alcohol and drug abuse counselor, who can help us begin to intervene on behalf of some of the patients who are struggling with substance use issues and may be among the most reluctant to be able to come to a provider either downtown or in some other setting. Our goal is not to be primary care providers. In fact, we're going to make arrangements for primary care for many of our patients. So we hope to raise enough funds over the course of the next several weeks to be able to outfit the van fully, have a medical side and a dental side, get all of the capital equipment that we need to provide services. The City of Nashua, with its public health department, will staff the van along with the nurse practitioners from Riviera. We're excited by this. The whole idea is to be able to bring things to the community in a way that provides access, and this is the best way to be able to do it. We hope you'll support us in this endeavor.
Hi there, and welcome to our outreach van. This is the outreach van that we utilize to bring services to people that struggle to come. We can actually serve two people at the same time. One is in the back that is very private. It's very simple, and it's comfortable. The other room, we can sit. If a mother comes with a child, they can comfortably be sitting here, and one of the nurses or myself will be in this part, conducting the education part, and the nurses will be doing the immunizations or whatever people are here for.
We go to at least 3 towns, 3 times a week, and we provide all of different kind of services. It might just be an immunization clinic depending on the site, because maybe that's what they will allow, but then other sites will allow us to do HIV testing or hepatitis C testing, or maybe do other things like blood pressure screenings.
The van that the city has right now has been in use for about 15 years, and it services a lot of people. Primarily it goes into more of our underserved areas, our lower income, people that maybe not have health insurance are seen a lot on the van, but we want to take it to the next level and start to also see people that maybe haven't traditionally gone on the van, people that might have health insurance but maybe it costs too much. So we really want to make sure that this van is not only serving those underserved populations, but really taking it to everybody in our region.
The seniors come and they are so appreciative of our services, especially giving them the shingles vaccine. Sometimes it's not covered by the Medicare, either Part A or B or at all. So the state provides us with some vaccine, and sometimes the city provides us with some vaccine. So they come and they say thank you to me, and we just offer our services every time we're there, and everybody's passing the message, and all of them are lining up for that.
One thing that has really meant a lot to me is when I work with residents or I work with patients is seeing the benefit that they get when they receive those services. And when I did work in public health and I was in the community and heard stories of people saying it was so great to be able to get that immunization, or I didn't know where to go, it really means a lot, and I'm really excited that this new van is going to just bring it to that next level that we really need to see in our region.
I've been working for the division for my last 10 years. And when I got to the division, this outreach van was already in existence. That's what I think, that if we get a newer outreach van with more services, it would be a win-win situation for us and for the community that we serve.
Public health is about my health, your health, how do we prevent diseases and lead a healthy life. And to me, it's a no-brainer when we talk about increasing access to care and having a clinic on wheels, essentially, going into our communities to provide those services.
Right now we have a van that is old, a van that is having some difficult issues with maintenance. It's not accessible to all of the sites that we want to reach. With the new van, that's going to increase our capacity to have people have access to care. So when we get the new van, it's going to be handicap accessible and everybody can get on it. That'll be awesome.
A new mobile health van will enable the City of Nashua to do outreach to many people who do not have access to public health services. Having this van in our neighborhood and in our surrounding communities will provide many services to people who can't reach them now. Thank you for coming out and supporting this important cause.